Hi, welcome to Bryoni's dental surgery. How can I help? You've got an appointment. Okay, what's your name? And date of birth? Lovely, I've got you here. So if you could just fill in the forms on the desk just to prove that, you know, you've got no illnesses that we need to be aware of or allergies that we need to be aware of, and then you're good to go, and Bryoni will call you out when it's your turn. Okay, thank you. Hi, how can I help? Yeah, this is Bryoni's dental surgery. You're in the right place. Yeah, we do accept walk-ins, however, we are fully booked today. You might best off just to keep trying. If there's a cancellation, I can give you a call. Yeah, I can take your details. Is that okay? Yeah. So what's your name, lovely? Okay. And date of birth? Okay. And just confirm your address for me and postcode. Yep. Is that N or M? Okay, sorry. Can I take a mobile number, please? Yeah. Lovely. Right, so I've got all your details down, and if there is a cancellation, I will give you a call. If not, then just keep trying to pop in, okay? I'm sorry that we couldn't help you today. Alright, okay, lovely. Have a good day. Bye bye. Hi, welcome to Bryoni's dental surgery. How can I help? No, we don't actually take phone bookings. All bookings are just made online on our website. We used to take phone bookings, but honestly the phones were just crazy, and we were getting complaints that it kind of seemed like a doctor's surgery and no one could get through. So we just did online bookings. Sometimes we take walk-ins if we're not busy, but we have been quite busy lately, so we've stopped doing that as well. But unless you're lucky and you come in on a day where someone's cancelled. But I can take your name down and your details down for cancellations, and if someone has cancelled, I can give you a call. Yeah, we can do that. Okay, what's your name? Date of birth? And just confirm your address and postcode for me. Street, yeah. SW. And can I take a mobile number or a house phone? House phone, yeah. Lovely. So that's all your details taken down, and like I said, if there's a cancellation, we will give you a call. Okay. Okay, lovely. Have a good day. Bye bye. Just 1 second. Hi, how can I help? Yeah. You've got an appointment. Okay, let's have a look. Can you just confirm your name for me, please, and your date of birth? Yeah, I've got you here. 9:20 with Bryoni. Okay, and it's just for a checkup. Yeah. Okay, brilliant. Checkup at £29.50. I know it's gone up, yeah, because of every year, but we can't Yeah, you can pay beforehand, that's not a problem. Yeah, let me just get your card off you and I will swipe it. Thank you. Okay, let me just try that one again. And okay, brilliant. That's gone through. Thank you. I'll just let Bryoni know that you're here. There's just one person in front of you, and then you're next. Alright, lovely. So if you just take out one of these forms on the desk and fill it out for us, it just lets us know if you've got any allergies that we need to be aware of, or any illnesses that we need to be aware of. So if you could just fill it out for me and give it back to me before you go and see Bryoni. Okay, lovely. Thank you. If you just take a seat and fill that form out, and she'll be right with you. Alright, thanks a lot.
Could I have the 920, please? Oh, hello there. Come on in, take a seat for me just there. How are you? Good. You're here for your dental checkup, is that correct? Excellent. Alright. My name's Bryoni. It's lovely to meet you. Please just sit back, pop your head back and just relax for me. Okay? So I am just going to ask you some questions. How have you been feeling? Sort of your day-to-day self? Are you well? Okay, good. No concerns. Are you in any pain at all regarding your mouth, your teeth or your gums? Okay. And do you have any current swelling? Okay. Any sores at all? Okay. Any ulcers? No. You don't have any cracked lips? Nope. Okay. And how is your throat? You're not sore at all? No? Okay. So just to check up then. You've got no concerns at all that you need to run by me regarding your mouth? No? Okay. Alright. So what I'm going to do, I'm just going to pop some gloves on. Alright. And we'll have a little look at your teeth. Okay? I just need to ask you, did you fill the form out given to you from my lovely receptionist? Yes. That's the one. You just give it back give it back to her on your way out. Okay? Alright, let's have a little look at your teeth. Okay, I'm just gonna go. Just open your mouth. Oh. I'm just gonna put a mask on. I don't think you've brushed your teeth before you've come to see me. Okay? It's okay. I just pop one on sometimes. Okay. Hopefully you can hear me alright. So let's just have another little look. Open up wide. Good. Keep your mouth open. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Just gonna check the top. You've got a slight bit of food there. I'm just going to clean that. Okay, I'm just going to use this brush. Just want to give you a clean. And at the top. Good. Sorry. It's okay. Honestly, it's fine. I'm used to it. Alright. Just going to have a little look looks fine. I'm just going to use my magnifying glass just for one moment, because I think you've been grinding your teeth in your sleep. Yes, do you usually grind, do you know? It's very common. Please don't worry if you do. You've never noticed it? Okay, I just want to have a little close up at your front teeth. Okay, at the bottom they're looking a little bumpy. Yes, I'm just going to have a little look, okay? Alright. Okay. It looks like you have been grinding your teeth. Okay, so I'm going to have to fit you a mouth guard. Is that alright? Please do not worry. The rest of your teeth are absolutely fine. I've got no concerns with them. I've thoroughly checked all of your teeth. The only thing I noticed was that the front of your teeth, they're a little gnawed or bumpy. They're not as straight, and they can suggest that you've been grinding your teeth while you've been sleeping. It's the most common. I don't think you walk around day to day grinding your teeth, so I only assume it's at night time. So are you happy for me to fit a mouth guard? It won't take long, a few minutes. It's all included within your appointment, please do not worry. Okay, great. Alright, so I've just got a clean one here. Okay, so I'll just got you your own box. Alright. So what we're gonna do, I've got a clean packaging here. Alright, and it comes with its own box. Okay. So what we're going to do, we're only going to fit one, okay, and it's just going to go on the bottom of your teeth, so that when you close your teeth, your top teeth will balance on the mouth guard, okay? It's almost like a retainer, if you've ever worn one. They're quite comfortable actually. I often wear mine as well. So what I'm going to do, we have a blank one here, okay, which obviously doesn't have your teeth fit into it yet. So what this will do, you just put it into your mouth, we'll hold it for 30 seconds, take it out, I will just wait for it to dry, and then your mouth guard should fit to your teeth shapes, okay? And what you'll then do is close your mouth, and when you sleep, just sleep with it in, it shouldn't bother you at all. And if you do grind, you're just going to be grinding down on this, not on your teeth, and it should protect them for a little bit longer. Okay? So, just open your mouth for me. That's good. Let's make sure that's firmly down. Okay, and just bite on that. Good. We're just going to keep it in for 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, let's take that one out. Good. Okay. It's a little bit wet, but that's okay. We're just going to leave it to dry in the box. So what that's going to do is just set. We need it to set. the most important thing. Okay. So 1, 2, 3, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay, I think this is done. So as you can see here, it's actually fit to your teeth and to your mouth shape. Can you see that? Alright, so now this is your personalised mouth guard. Okay, we can test it if you just want to pop that one in. There you go. Alright, if it's okay. Good, let's take that out. Put it in the box for you. So this is your own personalised mouth guard. Alright, so what I suggest is you keep it in this box. Alright, and you just want to keep it safe until you go to bed. Give it a rinse, pop it in your mouth, keep it in there the whole night. Sleep with it in, okay, and when you wake up, take it out. And you can brush it like you would with your teeth, but just don't use warm water. Make sure you use cold water, okay? And leave it to soak, and then you can wear it again the next night. Alright, but everything else regarding your teeth is absolutely fine. I'm not concerned at all. Everything looks all good and well. Alright? So you have absolutely nothing to worry about. Okay, so I'll give you the mouth guard. Alright, that's it. That's all for today. You're more than welcome. I'm just going to pop in here that we've done a mouth guard. And like I said, it's all included in the price. This should help you and protect your teeth. Okay? There we go. Alright. Thank you. You're more than welcome. And if you would like to come back, just give us a call, okay, for anything at all. Alright, take care. Bye bye.